Hi guys, so I've just had an email. I've recently done the MyHeritage DNA health testing to see what genetically I would have passed on or what I'm at risk of getting in the future. So, and I've literally just got this email because they already had my DNA, they could do the testing within a few days. Otherwise, you need to order the pack and pay for it that way. So I haven't looked at this at all. I've literally just put my password in, so I'm just about to find out. A bit scary, but hopefully this stays clear. So yes, I'm just about to find out for the first time what this might say. So it says, "Hi Diane, welcome to your genetic risk report. This is a quick introduction to help you better understand your results. What your DNA can tell you about your health." I really wish this was clearer for you. DNA contains the genetic instructions for the body. Most of the DNA in humans is the same. The differences are called variants and can tell us a lot about our health. Next page. What is genetic risk? Most medical conditions are caused by a combination of non-genetic factors such as lifestyle and environment and genetic factors, the DNA you were born with. The impact your genetics has on your health is called your genetic mark. How do we determine your genetic risk? For some conditions, the BRCA related... Hang on, I'm trying to read this on this phone I'm holding. It's a bit blurry. Yeah, the BRCA related cancers, we analysed a few variants that are strongly associated with conditions. For complex conditions like heart disease, we analysed thousands of variants. We combined the results of all these analyses to calculate your genetic risk score, a cutting edge method for estimating the genetic risk. Basically, I've also signed up for the next 12 months results. Basically, when they do the new testing, if any other new tests come out for the next 12 months, I'll automatically get a risk factor for them new tests as well. What does it mean if you have an average or decreased risk? Having an average or decreased risk is reassuring. However, it does not eliminate your chance of developing a genetic condition. Is it helpful to know whether you have an increased risk? Yes, knowing that you have an increased risk for a condition can help you make informed decisions about managing your health. Your reports provide your genetic risk estimate for certain conditions. They do not tell you whether you will definitely develop the genetic condition or the severity of that condition should it develop. Ready to see your genetic reports? Yeah. Yes and no. Excuse me. Remember that these reports cannot replace a regular medical testing. You may also wish to share these results with your healthcare provider, which I'm going to. So here we go. Reports for incurable conditions. Some genetic risk reports show genetic risk for serious conditions that currently may not have an effective treatment or cure, like Alzheimer's disease or Parkinson's disease. Some users, including those who experience anxiety or depression, may prefer not to see them. Additional considerations: even if your results indicate an increased risk for specific conditions, this does not mean that you will definitely develop the condition. Genetic testing for these conditions is not recommended by healthcare organisations. Do you want to include genetic risk reports for Alzheimer's disease or Parkinson's disease? This question is presented to all users and does not mean anything about your individual results. I'm going to put yes, include them, because I want to know everything. As you know, I suffer with ill health anyway, and so I'm an only child. We don't know much, well, we don't know anything about my mum's father side of the family, so obviously I'd like to know what I could basically be passing down to my children, because obviously my grandchildren have got some health issues, and maybe some of this might show up as to it's come from me, or genetically it's come from me. You can always change your decision. No, I don't want to change my decision. Right, I'm going to have to blurt out my surname just for security reasons on there. Your reports are grouped by a level of risk. These risks are based on your genetics alone, and cannot tell you whether you definitely will or will not develop these conditions. Click on any condition below to learn more. You have a significantly increased risk for the following condition. Oh, here we go. Celiac disease. Now that makes me laugh because doctors have done a basic test for celiac disease, because obviously I've had severe stomach trouble since I was a child. I mean, talking like 8-9 years old, and it's now classed as like IBS, but I think it's more than IBS. So there you go, celiac disease. So I'm going to be going to my doctors to follow up on that. Oh Jesus, I have an increased risk for the following condition: a late onset of Alzheimer's disease. Now, none of my family I know have got that, but one relative at the moment is looking like they might have this. I have an average risk for the following 15 conditions. Oh Jesus. An alpha-1 and antisprin deficiency. Well, let's see what that is. No pathogenic variants were detected for alpha-1 deficiency. These results suggest that you have an average risk of developing an ATT-related lung and liver disease. Jesus Christ. It's really scary getting this, guys. I'm not going to lie, but it's better to know than not know. Oh, Crohn's disease again. Another stomach disorder. Something again I've only had a basic test for. I would flag that up with my GP, because again, I've had long-term stomach problems. And that says average risk. Crohn's disease. So that's Crohn's disease, celiac. So yeah, so we all know what most of us know what Crohn's disease. Female breast cancer. None of my family's got that as far as I know, but again, we don't know much about my mum's father's side of the family. The risk report shows that your genetic predisposition for this complex conditions like female breast cancer. Your results for these conditions are based on the analysis of the large number of variants and the effect that they have together on the overall genetic risk. These reports look slightly different than reports for other conditions that are based on only a few variants. Right, okay then. Oh. I've just come off that page. Silly me. Let me go back to it, guys. Again, I need to blow it out. So at the minute, now that I've gone back onto it, I've got an increased risk just for the celiac disease and the late onset Alzheimer's. So at the minute, I think that's only showing the two things that I've got increased risk. Chances are that's what I could probably develop. And so female breast cancer, that's what we were on. Right, we all know what female breast cancer is. G6PD deficiency. No pathogenic variants were detected for G6PD deficiency. These results suggest that you have an average risk of developing it. What is this? We analysed two variants of the G6PD gene known to have significant impact on your genetic risk of developing G6PD deficiency. There are additional variants associated with this condition. We did not analyse them. Learn more. But what is it though? Risk among women. The condition is X-linked to the gene causes the condition of the X chromosome. Males have one chromosome, women have two. Development, blah, blah, blah. Different to men and women. While your risk is not increased based on the testing. Oh, well, genetic risk estimate calculated on using the research. GP, I'm going to have to look that up, guys. G6PD deficiency is caused by presence of at least one copy of the pathogenic variant. It's highly unlikely to develop this condition without having at least one copy of the genetic variant. However, not all people with a genetic variant, G6PD with deficiency, will develop symptoms like anemia and other factors, infections. Medications may influence when anemia develops. So that's maybe a type of anemia. That's kind of good to know. Your genetic risk estimate shows that you have an average risk of developing it. Anemia, that's good to know because I do have problems with my iron, and so do all of my daughters. So that is actually good to know. Oh, if I come out of that now, is it gonna go back to the beginning again? No. Heart disease is the one I was scared of because there's quite a lot of that in the family. Shows your genetic predisposition for complex conditions like heart disease. Your results for these conditions are based on analysis of a large number of variants. They affect together your genetic risk. These reports look slightly different. Blah, blah, blah. You read that for the rest of the stuff. Oh, dear. Oh. Right, it's not going to show me that, so basically it's just an average risk. Hereditary BRCA cancers. Again, there's some cancers in my family members just now, so no pathogenic variants were detected in your BRCA genes. That means just at the moment. So this result suggests that you have an average risk of developing hereditary BRCA cancers. Know that you have an average risk for developing female breast cancer based on your report. We don't need to go into that. I can go into that later. We analysed 103 variants of the BRCA1 genes known to have significant impact on your genetic risk developing hereditary cancers. However, there are thousands of variants for BRCA1, BRCA2 genes that may be associated with hereditary cancers, so you could still have a pathogenic variant that we did not analyse. Since no pathogenic variants were found in your BRCA genes, your genetic risk estimate for breast cancer is based on polygenic risk scores. Or pancreatic cancer. The average lifetime risk of developing pancreatic cancer for the general population is 1 to 2%. Based on the variant tested, your genetic risk is not increased. However, it's still possible for you to see. That's good because I was worried about that because my grandmother passed away from bowel cancer. The female breast cancer, there's no one in my family. It's got the breast cancer. Where was that ovarian one? There was ovarian cancer there a minute ago that I wanted to look at. Ovarian cancer. Just because I have a lot of issues and another family member has had some cancer cells. Genetic risk estimates calculated, blah, blah, blah. General population, genetic risk factors. Putting it together, your genetic risk estimate shows that you have an average risk of developing hereditary BRCA cancers based on the variants tested. These cancers include breast cancer, ovarian cancer, and pancreatic cancer. Other factors like your environment and lifestyle might also have an effect on your risk. It's important to continue with any cancer screenings, what to do next. So that's good. Average risk means, yeah, I could do it, could get it, but it's really good to get this to change your lifestyle, guys, because I must admit my diet's not great, and this kind of gives you a shock, kick up the arse to go, you know what, I need to change my life now. I'm already suffering with a lot of health problems, as you know. Oh, this one's good. Well, not good, but you know what I mean. These results, so you have an average risk of developing late onset Parkinson's disease. Again, it's average risk, it's not a decreased risk, so yeah. There are additional variants associated with this. Genetic estimate. Genetic risk factors. Putting it together, your genetic risk estimate shows that you have an average risk of developing late onset Parkinson's disease based on the variants. What can I do next? Which is kind of interesting because I have the shakes and stuff like that already. Balance problems. Again, I'm going to flag that up a bit with my GP. The high blood pressure, I know I've already got that. Oh, I've missed out some. Hereditary hemochromatosis, I haven't got a clue what this is. There is average risk of hemochromatosis. Does anybody know what that is? I'm going to have to look it up. We analysed 2 variants in the genes, blah, 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 blah. Your risk estimate, you have an average lifetime risk of developing hereditary hemochromatosis less than 1%, which is consistent with the average risk. So I'm on the average risk for that. Your genetic risk estimate shows that you have an average risk for developing this hereditary hemochromatosis. The variants tested other factors. A bleeding disorder may also put you at risk. Like history of bleeding disorder. So that's what that is. So again, that it doesn't make me laugh, but it's weird because I had a severe hemorrhage after I had one of my children. So whether that's got something, it could be related to that. I don't know. Hereditary thrombophilia. Something to do with blood clots. Because I've already had them too. No pathogenic variants were tested. We analysed 4 variants, 4 genes known to have significant impact on your genetic risk for developing hereditary thrombophilia. These variants are consistent with thrombophilias called, God blimey, prothrombin-related thrombophilia, factor V leading protein C deficiency, protein S deficiency. These are additional variants associated with this condition that we did not analyse. Your average lifetime risk estimate developing venous thromboembolism VTE, which is an abnormal blood clot, that starts in the vein, which is consistent with risk with your general population, blah, 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 genetic risk estimates. Again, I've had blood clots after I had one of my daughters. Putting it together, your genetic risk shows that you have an average risk for developing hereditary blood clots, basically. Again, with high blood pressure, being overweight, this is the kick up backside to really change my lifestyle. And obviously this is genetic, so if my family are watching, kids are watching, parents watching, it affects them too. Do you know what I mean? So Parkinson's disease one's a little bit concerning for me because, as I said, I've got kind of symptoms of that. So yeah, an MUTYH associated colorectal cancer. I have an average risk. Average risk, I think, is just basically like same as an average person, but obviously lifestyle, genetics doesn't mean to say that I'm not going to get it. I'll just have an average risk. So putting it together, I'll have an average risk for developing colorectal, so basically colon cancer. Again, that did concern me because my grandmother passed away from bowel cancer. Obesity and high BMI. Well, it's good to know that if it's just what I'm eating that's making me fat, or am I genetically predisposed to being like fat? So polygenetic. Oh God, I can't even talk now. Polygenetic risk reports show your genetic predisposition to complex conditions like obesity and BMI. Your results for these conditions are based on the analysis of a large number of variants and the effect that they have together on your overall genetic risk. These reports look slightly different than reports on conditions that are based for only a few variants. Let me cross off that. My is it not clicking on that? Let me see. Again, there's just so many, guys. I'm not gonna read it properly. Just the ones that I kind of think that we've never heard of. So high blood pressure, we know what that is. I'm going to read into that later. Parkinson's disease. That's a breast cancer. Oh my, you know what that word is. It's a HIV-1 infection. Didn't know they were going to test for things like that. No protective variants were detected for that one to HIV-1 infection. This result suggests that you have an average that one. Basically, it means you know what you have of getting it. No protective variants. Does that mean that I'm you have an average susceptibility to HIV-1 infection? That means if exposed to the HIV virus, your risk of infection is average and not influenced by your genetics. Right, okie dokie then. Not to come out that one. So yeah, this is really, really good, guys. Definitely get this. Breast cancer, HIV, susceptibility to malignant hypothermia. Okay, never heard of that either. Just goes about whatever it is, less genetic risk factors. Putting it together, your genetic risk shows that you have an average susceptibility to malignant hypothermia based on variants tested. Other factors like environment, lifestyle, you may be also at risk. I have a slightly decreased risk for the following conditions. Type 2 diabetes, that's good. I have a slightly decreased risk for the following condition. Age-related muscular degeneration. That's good. And I think that's it, guys. Oh, hang on. No, there's not. Genetic risk. Carrier status. This might mean stuff that I'm going to pass on. Now, this is going to be the thingy for me. What are carrier reports? What does it mean to be a carrier? A carrier is someone who has altered the copy of a gene, also called pathogenic variant, that is associated with a disease that could be passed down to a child. It is normal to be a carrier even if you are healthy but do not experience any of the symptoms. Many of the carriers are at least one genetic disease. How can carrier status affect your family? So there we go. That shows you how it can be passed on. Half from dad, half from mum. Do you know what I mean? So for most diseases, both you and your partner have to carry the same condition. For your child to be increased risk of developing the condition. Note that you have a child who is planning to start his or her own family and you find that you're a carrier. Your child may be a carrier too, and you could advise them, see, this is what I want you to do. Shame these tests went out years ago. Carrier status reports have limitations. They are not diagnostic. They do not include every condition and do not include every variant of conditions tested. They cannot replace the clinical genetic screening. They are useful for most specific ethnicities such as Ashkenazi Jews. Carrier status, again, I'm going to have to blur out my surname. Your carrier status for each condition is shown below. Our reports do not include possible variants for any conditions, therefore there is still a small risk that you could be a carrier, even though the report indicates that you are not likely to be a carrier of the condition. Click on any condition below to learn more. You are not likely to be a carrier of the 23 conditions. So, showing 23 of 23, I'm not likely a carrier of the 23 conditions. So basically, I'm not likely to be passing any of these on. So, ataxia, whatever that is, syndrome, Barrett-Bell syndrome, congenital thrombo, whatever that is, Canavan disease, cystic fibrosis. Never heard of any of these. Mediterranean fever, Fanconi anemia, Gaucher disease, glycogen storage disease, Gray-Seal syndrome, hereditary fructose intolerance. I'm glad I'm not a carrier of that, because that would be a nightmare. Duplex syndrome 2, limb girdle muscular. Yeah, blimey. Blimey, sickle cell, Take-Such disease, Usher syndrome. So that's good, guys. So it says I'm not likely to be a carrier. So there's nothing on there. So that's good. So I've just got the genetic health screening. So basically, there's a lot of things I need to flag up with my GP of illnesses that I've got, and it says I'm kind of at risk at, and other stuff that I could be at risk at. Again, I'm going to bring out my GP. My carrier status, as you've seen from what they've tested, I mean, there's hundreds of other diseases, but the ones that they've tested, I'm not likely to be a carrier for. And obviously, I've signed up for the next 12 months for any new testing that comes out. I automatically get an update as to whether I'm genetically predisposition for it, or if I'm going to be a carrier and things like that. So there we go, guys. So that is my health report with my heritage DNA. Thanks very much for watching, and I really hope this inspires you, literally, especially if you're going to be planning a family. I wish these were out years ago, because I definitely would have done this before having a family, just to make sure, because you just never know, you know, that you're safe, that you could be carrying anything, or you can change your lifestyle for the future. I highly recommend getting this done, guys. Honestly, yeah, it's a good kick up the bum for me. I'm going to be changing a few things. So again, thanks for watching. Take care. Ciao for now.